Hello, and welcome to the ChoiceFM podcast. I'm FD Gifford, and I will be your host for the next 15 or 20 minutes. I hope this show will become a favorite, and if you get value from our regular transmissions, please hit the subscribe button so you will be notified of our next episode release. As you may know, the ChoiceFM is our primary broadcast vehicle and is a central part of the YWNH Media Company. If you are new to the community, this show is intended to be distributed weekly and will cover the important topics of our time and how they impact our daily life and lifestyle from a health and wealth perspective. The Choice FM content is a combination of reporting news and information as found and determined by the show's editors, along with their review and commentary. We invite you to join us each episode, share our broadcast with your friends and family, post comments, and maybe someday join us on air as either a caller or a guest. Now let's jump in and kick off the show. I thought I'd do something a little different today. Instead of focusing on just one topic, I cover some of the top headlines and news stories recently and share my thoughts on them. First up today is a story about a recent poll titled 70% of marketplace enrollees satisfied with Obamacare. This story comes from Freddie Allen at NNPA Newswire via the Washington Informer. Clearly, the author of this story is not a fan of President Trump, in my opinion. Let me know what you think in the show's comments. It opens with, as President Donald Trump continues to sow confusion about the Affordable Care Act, a recent poll by the Kaiser Family Foundation shows that although some of his tactics are working, many consumers still plan on signing up for health care during the open enrollment period. The ACA open enrollment period started on November 1 and will end on December 15th in most states, despite its critics. The law has effectively reduced the uninsured rate for blacks. Healthcare advocates have said that access to preventive care provided by the ACA could also limit the effects of healthcare disparities like infant mortality rates and deaths from breast cancer among black women. Even though the ACA is also known as Obamacare, provided health care to millions of Americans, the president has worked to cripple the law in tweets and actions through, quote, deep cuts in funding for advertising about the ACA, end quote. The previous year's television ads played a key role in educating people about open enrollment and the ins and outs of the ACA. In my opinion, I guess this explains the butthurt we see nightly on mainstream media networks. If, quote, Trump cut the advertising budget to the bone, end quote, maybe that decision was based on its low return on investment by a government holding $21 trillion in debt. But that's just my thought. Anyway, I thought the story was about a poll, right? Well, reading on. According to a recent Kaiser Family Foundation poll, quote, a few of those most likely to consider marketplace coverage report hearing or seeing any ads providing information about how to get insurance under the healthcare law. Well, less than 20% of the uninsured and just 12% of market enrollees said they saw an ad in the past 30 days that provided information about how to get insurance. The poll also reported that just 5% of the uninsured and 25% of the marketplace enrollees were aware of the month when open enrollment ends in their state. According to the author, quote, White House efforts to discourage Americans from signing up for health care, and the House Speaker, Paul Ryan, claims that people would choose not to buy Obamacare if the government didn't force them, end quote. However, the poll states that 90% of marketplace enrollees said that they would continue to buy their own insurance even if the government stopped enforcing the individual mandate. Not surprising, in my opinion, since these individuals who have enrolled justifies eliminating the individual mandate, in my opinion. Finally, let's get back to the headline. Most marketplace enrollees like their health insurance under ACA. The Kaiser Family Foundation poll revealed that 70% of the current marketplace enrollees are satisfied with their insurance choices. Again, I am not surprised. Most individuals who enroll via the health exchange marketplace do so because they are eligible for a federal subsidy to reduce their monthly premium, no matter how high the health insurance plan costs go up. In fact, some analysts believe rates are going up because of this subsidy and call this corporate welfare. Proving my opinion, the author adds, quote, most enrollees will also get help paying for health care through the ACA, and insurers are still required by law to provide reduced deductibles and copays for low-income marketplace enrollees. This is said Larry Levitt, Senior Vice President for Special Initiatives and Co-Executive Director of the Foundation's Program for the Study of Health Reform and Private Insurance. Quote, premiums are increasing, but consumers will also get more help. The article goes on discussing the opinions of enrollees on renewing in existing plans if they were available in 2016, and highlights the need to enroll early to avoid a normal rush as enrollment ends on December 15th. You are listening to the Choice FM podcast. Now, this story caught my eye, first of all because my specialty is health and wellness, but also, more importantly, because it seems to offer a broader opinion on the Affordable Care Act that may reflect what many Americans feel in total. I found this article on the Financial Channel, and it was written by Megan Brennan. Now, Ms. Brennan's article is titled, quote, Affordable Care Act approval slips after record highs. It begins with, quote, after several failed Republican attempts to dismantle the Affordable Care Act this year, 50% of Americans now approve of the law, a modest decrease from the record highs of 55% in April and 53% in July. Despite this slight decline, the current approval ratings for the law remain higher than all of pre-2017 Gallup readings on the question. Quote, while half of the U.S. adults currently approve of the ACA, 44% disapprove in the Gallup's annual November Health and Healthcare Survey conducted November 2nd through the 8th. 1 year ago, after the 2016 general election, 42% of Americans approved the law and 53% disapproved. While campaigning, Donald Trump vowed to replace the law if elected, and with Republican majority in Congress, such a move seemed likely. Now, the article goes on to review the congressional failures to repeal and replace the law this year. Quote, the House succeeded in passing repeal legislation in May, but separate efforts in the Senate failed during the summer months. The issue has come up again as the Senate has included a repeal of the individual mandate provision in the ACA as part of the tax reform bill, according to Gallup. Now, I agree with this statement. Quote, sharp polarization on ACA persists, end quote. Opinions of the ACA, commonly known as Obamacare, have been sharply polarized since the law passed without a single Republican yes vote in 2010. Compared with a year ago, more Democrats and independents now approve of the law, while Republican approval remains low. Currently, more independents approve, 50%, than disapprove, 43% of the ACA. Now, continuing on in her story, I picked up more ACA supporters prefer keeping the law as is, and fewer opponents want repeal. This is where the bulk of her story goes on. Last November, and again this year, Gallup asked Americans who approve of the ACA if they would like to leave the law in place as is or keep it but make significant changes to it. Americans who disapprove of the ACA were asked if they wanted to keep the law but with significant changes or to repeal and replace it. When the responses to the two questions are combined, an overall total of 42% of U.S. adults, a group that includes some who initially approve of it, 28%, and who disapprove, 14%, want to change the ACA significantly. That is a larger percentage than the 29% who disapprove and want the law repealed and replaced, or 21% who approve and want the law kept as is. Clearly, this law has been a partisan from the very beginning, and more likely that it will remain that way in the future. Citing data in the poll, the article reports, Democrats who approve the ACA are more likely this year, 41%, than they were last year at 26%, to say they favor keeping the law as is. Likewise, though not to the same degree, independents who now approve of the law are more likely than last year to favor keeping the law as is. For their part, Republican views are little changed from 1 year ago. Almost 9 in 10 disapprove of ACA, and about 7 in 10 prefer that it be repealed and replaced. My bottom line on this article is a bit different than their bottom line, and let me know if you agree in the comments. The article leads with the headline and offers a chart, but offers little more than more noise in the food fight in Washington over substance on this issue. Why should we repeal and replace, or should we just drop the mandates and move on? A quick look at the charts. Here's some of the key takeaways I saw. The percentage of Americans who approve of ACA has declined from a high on November 2014 at 56% and the next highest level of 55% in November 2016 to only 50% this November. And yes, this is not the lowest level of approval ever recorded, which was 36% back on November 2013. It does appear true that the healthcare law has been a major issue in every national election since it first passed in 2010, and it may well continue to be in the 2018 midterms. My third article I wanted to share with you today is really a commentary found in the Highland County Press. The editorial was written by Rory Ryan and is titled, quote, Taxpayers, Obamacare, and Congress. Guess who always loses? The following quotes from his commentary summarizes what I believe many Americans are really feeling. Quote, another enrollment period is now open for the American absurdity known as Obamacare, where the only citizens who capitalize on this political boondoggle are Washington politicians and the K Street lobbyists. According to the feds and their taxpayer-funded website, quote, finding the right plan can be difficult. Each plan has its pros and cons, especially considering how costs can vary depending on the plan's monthly premiums, deductibles, and copays. The good news is that the ObamacarePlan.com summarizes, the healthcare.gov, summarizes all the key information for you, making it easy to compare your options and decide whether you prefer to lower your monthly premiums with a bronze or silver plan or need to lower your out-of-pocket cost with a gold or platinum plan. We have you covered, it goes on. He goes on to say, to that statement, two words come to mind. The first one is, quote, bull. Perhaps as a compound word, one word may suffice. I'll bet you can figure it out, especially if you are among the millions of middle-income workers who are not receiving taxpayer-funded medical coverage, not even an aluminum plan. Quote, sadly, the majority of today's members of Congress have no freaking clue what Obamacare is doing to working Americans. Yes, those same working Americans who pay your incredibly inflated salaries, inflated pensions, perks, and yes, your medical coverage, end quote. Quote, collectively, all members of Congress ought to apologize to the working Americans for this ruse, especially the do-nothing Republicans, end quote. For 7 long years, you Republicans railed against Obamacare, didn't you? Hello, your silence today proves your previous deception, end quote. Quote, the House presented meaningless bills to repeal Obamacare when its namesake was still around in the Oval Office. But that was then. Meanwhile, all of you politicians knew full well that your quasi-conservative words sounded good at all those chicken dinners back in your districts and presented no personal challenge because then President Obama wasn't going to sign anything that landed on his desk to repeal his legacy legislation. Earlier this year, with majorities in both House and Senate and a supportive president, congressional Republicans were silenced. Their erstwhile determination and vigor to repeal and replace Obamacare has gone AWOL. Now, in my opinion, like so many other middle-income Americans, he shared this powerful statement, quote, I don't expect a single member of Congress to know what it is like for someone who works hard 52 weeks a year only to be penalized through the political drunken farce of Obamacare with an added tax for non-compliance with that which said workers simply cannot afford, end quote. He goes on and asks his representatives from Ohio, quote, has any one of you ever been in a situation in your lives where you were working for $30,000 annually, paying your local, state, and federal taxes, plus sales taxes, etc., and forced to purchase something that could, in theory, cost you $18,800 of your $30,000 a year before purchasing a single aspirin? Quote, is it any wonder that working Americans supported the current president? End quote. I am reasonably confident that the Congress had no idea of the uprising that occurred around this time last year. Look no further than Obamacare. Even the Clinton News Network has reported the lunacy of forcing the working Americans to send up to 90% of their income to the government for medical coverage that probably isn't worth horse spit to begin with, end quote. He cites a report from money.cnn.com on affordability. Here's the quote. For many middle-class Americans, a single person earning more than $47,520 or a family of four with an income of $97,200, the pricey premiums and deductibles mean healthcare coverage remains out of reach. Quote, the middle class is getting squeezed, said Larry Levitt, senior vice president of the Kaiser Family Foundation. Quote, they aren't getting subsidies and these deductibles are hard to afford. According to the report, quote, in 2015, 46% of uninsured adults said they had tried to get coverage but did not because it was too expensive, a Kaiser study found. For not being able to afford Obamacare, not only are these working Americans living without insurance, especially without so-called catastrophic coverage, they are also being forced to pay a penalty for being uninsured. Now, there are members of Congress, may or may not be on Obamacare, but that's irrelevant. Even if some are, guess what? They did not pay their own way. You paid for them. Yes, many of the millions of middle-income workers who cannot afford Obamacare see their personal tax dollars going to lucrative salaries, pensions, and health care for members of Congress, end quote. If that's not enough, these hard-working middle-income, by the way, Congress, stop calling us middle class. That is an insult. Do you also use the term low class or high class to describe your constituents? Americans also see their tax dollars going towards Medicaid, Medicare, and all the local, state, and federal insurance plans. After paying all these taxes and many others, the same taxpayers who cannot afford their own insurance are then penalized because, and he puts in caps, they do not have the money left over for their own insurance. Now he ends with something I wrote about in 2013. It is such a good example that is totally wrong for our leaders and in both parties. He offers this quote, and I totally agree with it. I think, quote, I think the president would absolutely be within his rights to cancel the Obama rule that conferred this subsidy on Congress. Representative Ron DeSantis, Republican of Florida, who said this in a recent Fox News report. Well, that's a wrap. I hope you got something of value and will visit my website at ywnhmedia.com or soon to be launched theChoiceFM website. Production. All rights reserved. I'm broadcasting today from the beautiful Carolina coast. Have a great day.